Okay, we're back with Dr. Jim Kimmey. We just have a couple of minutes, but we started the show with your perspective, and I'd like to end it with your perspective. What stood out to you tonight?
A lot of good information. I think it was very clear that we need more education, probably more plain English. There were a lot of words used that people weren't going to understand tonight. Part A, Part B, exchange, and donut hole. So I think that we really need to stress that plain English part. I think that exchange is a good example. They call it Connector in Massachusetts. It's a farmer's market in which insurance companies come and sell their goods to the people that come to the farmer's market. People can relate to that kind of image in a way they can't relate to the word exchange, which doesn't really make a lot of sense to them. ACA does not cut Medicare. Now, I think it came across in a couple of presentations. I think it's very important because that's been talked about a lot, that there are billions coming out of the Medicare program. There are, but they're coming out of three places. They're coming out of provider charges, they're coming out of fraud and abuse. They've doubled the amount of fraud and abuse recoveries in the last year. And they're coming out of the Medicare Advantage program, which has run 9 to 14% higher than conventional Medicare when it was supposed to be the same cost and provide more services. So there are a lot of things that in that bill. And then the other part of it is those monies are coming out, but a lot of new things are coming in. More preventive services, screenings with no deductible. It used to be you'd have a 20% deductible to have a colonoscopy if you wanted one. And so that 20,
no, thanks.
Yeah,
yes,
different strokes. But so that 20% deductible is gone. They can't charge that. Neither can the private insurers. Those kinds of things to give better access to preventive services are very important. The last point I had, Dr. Watson.